Okay, hi, this is Carissa Williams. We're going to do a neurological assessment this is week 4's lab. I would start off by doing my ADEP, so I would introduce myself. Hi, my name is Carissa Williams. I'm going to be your nurse today. We're going to do a neurological examination. It should take maybe 10 to 15 minutes to do it thoroughly. Do you have any questions? Do you experience any pain, any of the situations like that? Okay. Do you have any allergies? Any other type? Okay. I would, when I first walk in the room, I should do hand hygiene. My sink is over here. I would perform hand hygiene and I would wash my hands. I'd make sure all my equipment was already together. In this case, we're just using a random hodgepodge of things to replicate the cranial nerve items. So first, I would check her level of consciousness and mental status. So I'm going to check her ANO times 4, which is person, place, time, and situation. Can I have your name and date of birth?
Diane Williams, February 23rd, 1966.
And I would check her hospital band because she should have one on. Okay, where are you today?
Highland, Illinois.
Do you know why you were here?
For a overall assessment.
Okay. Can you tell me the month and year?
March 2020.
All right. So she is ANO times 4. She knows person, place, time, and situation. She seems, she's awake, she's alert. Her mood is appropriate to the situation. I can tell her hygiene is good. Her dress is appropriate for quarantine time. She is understanding the questions I'm asking her and she's responding appropriately. She's got good posture, her energy seems appropriate, movement, grooming, facial expressions, all as they should be and normal for somebody for this time. Her speech is clear when she's responded back to me and she knew what she was supposed to be talking about. So now we're going to check the cranial nerves. We're going to start with cranial nerve 1, which is olfactory smell. We have our little smell thing. You would use something that people are easily recognizable. In this case, we're using vinegar. I would not obviously tell my patient this, that you're using vinegar. Just saying this to you so you know what's in this cup. You have them close their eyes and see if they can identify the smell. I'm not breathing when I'm doing that because that's horrible. Okay, that's apple cider vinegar. Okay, so now we're going to do, and so she could smell that and she identified it. We're going to do cranial nerve 2, which is optic, which is visual acuity, using a Snellen chart. We obviously don't have a Snellen chart. If we did, you would have them stand 20 feet away from it and read whatever line they could. But we don't have one here, so we're just going to go ahead and check that off. She's not wearing any glasses, she's wearing contacts. Okay, so now we're going to do cranial nerve 3, oculomotor pupillary response, and we're going to do our PERLEP. Her pupils are equal, they are round. I would have a pen light, my son displaced mine, so we're going to use this little highlighter as a pretend pen light. I would shine the pen light on both eyes and check that they are reactive to light. They should be dilating together and consensually when I do it over one eye. And then I'm going to check accommodation. You're going to stare at this pen and it's going to come towards your face and keep staring at it. Okay, her pupils are accommodated. Now we are going to do 3, 4, and 6, oculomotor, trochlear, and abducens. This is for extra eye movements. We're going to use this again. We're going to do the 6 positions of gaze. So once again, you're going to stare at this and you're going to follow it with your eyes. Okay. Okay. Good. Good. Okay, she was able to follow those. So cranial nerves 3, 4, and 5 are 3, 4, and 6 are working. Now we're going to do 5, the trigeminal. And she's going to clench her teeth, and I'm going to check her maciator and temporal muscles to see that they're all working. Can you clench your teeth for me? They all feel like they are tensed, like they should be. Okay, so now we're going to do cranial nerve 7, which is facial smile, frown, which is facial. So we're going to test it by doing by doing her, she's gonna raise her eyebrows, she's gonna smile, she's gonna frown for me. So can you smile for me? Can you frown, make a sad face? Okay, and you raise your eyebrows, so it all works. Okay, now we're gonna check cranial nerve 8, which is her hearing and balance. So far, she's being able to answer my questions appropriately and follow my instructions appropriately, and as she should. So her hearing, I could say, is well. Now you're going to do a Romberg test. So can you please stand up? This is going to test your balance. I need your feet together. You're going to close your eyes. She should not have any swaying. Somebody who has neurological issues, once you take away sight, their equilibrium goes off, and they're going to start swaying when they do that. But she's not, so that means her neural function is good. So you can sit back down. Okay, now we're going to do cranial nerves 9 and 10. This is your glossopharyngeal and vagus. Instead of using a tongue depressor, we're going to use the end of a toddler spoon because it's about the same size and about the same weight. So can you open your mouth for me? Stick your tongue out. Can you say ah? Okay. You don't want to put it too far back in the mouth, or people might have a gag reflex. She was able to do that. Now we're going to check cranial nerve 11, which is spinal accessory. So I'm going to place my hands on her shoulder, and she's going to try to push up against my hands. That was good. She can do that. So now number 12 is hypoglossal, and this is mobility and strength of tongue. You test it by having them say light, tight, and dynamite. So can you say light, tight, and dynamite?
Light, tight, dynamite.
Thank you. And she was able to say that, so that's good. Now we're going to do motor and cerebellar systems. So one thing we're going to do is the finger to nose test. This checks that they're having problems with visuals and seeing where they're reaching to, and that coordination between doing that. So I'm going to have my finger out here. You're going to touch my finger and then touch your nose and go back and forth. Good job. Okay, and then we're also going to do a muscle test by having her squeeze my fingers in both hands. So you can do that. Good job. Okay, now we're going to check sensory. First thing we're going to do is also checking cranial nerve 5, the trigeminal, which is facial sensation. We're going to use this little cotton round, and we're going to do a light sensation on her T-zone, forehead, down to your chin, and across your cheeks. And she's going to say now when she feels the light sensation on her face. Okay, so all her facial sensation works. Now we're going to check for stereogenesis. You place a small object that they can easily identify in their hand. We're using paper clips today. I would not normally tell her that because she's supposed to identify it. She's not supposed to know it's already in her hand, but I'm just informing you. So she's going to take her hand out. She's going to have her eyes closed. I'm going to put it in her hand. She's going to be able to feel what that is.
Paper clip.
Okay. And now we're going to check graphesthesia, which you would write a single letter or single digit into the palm of their hand and have them be able to tell what it is.
J.
And the letter J, and she was able to say that. Okay, so we're done. Okay, now we're going to do a positions test. I'm going to. My son's getting into things. So now we're going to do a positions test. I'm going to lightly poke her and see if she can identify where I poked her, as close as possible. Okay, she's able to do that, so she can feel a sensation. Now we're going, and if we had a tuning fork, we could test for peripheral neuropathy. You would hit the tuning fork in the palm, the heel of your hand, and you'd place it on your big toe and see if they are able to feel the sensation, because feeling that kind of light sensation in your feet is the first thing to go with peripheral neuropathy. But we don't have that, so we're going to move on to deep tendon reflexes. First, we're going to do her brachioradialis. We're going to go up her arm, and then we're going to go back to her lower extremities. You would find the bony prominence on the radial side, so it would be above the thumb, and you go about 2 inches above that. You will feel a tendon in there. And once again, you could have her make a fist and squeeze, and you can find it a lot better that way. But she's gonna relax. We're gonna do this. And I am right-handed, so I'm gonna go like this. And her fingers should twitch slightly. Her fingers twitch, so it works. Now we're going to do her brachial tendon. Once again, you can have her flex, and it'll be easier to find it. She needs to be relaxed for this. Has a rope-like feeling inside her arm. Relax. And there should be some sensation in her fingers and her hand. Her fingers switched a little bit, so we know it's working. Now we're going to do her triceps. This is above her elbow on the back of her arm, and you can feel it in there, and her arm should kick out a little bit like that. A good reaction there, so that works. Okay, now we're going to do her knee, and it should be dangling. So somebody who's really tall, you might have to put them on something higher, but she's going on this bar height stool. So if you needed to find it, you can have her stick it out, her leg out, and you can find it much easier. And her lower leg should kick out. Her lower leg kicked out. Can't really see it on here, but it did that. Now we're going to check her Achilles. You would hold the front of her foot like this and have it dorsiflexed, and you would hit the back of the Achilles here. You can't see the camera, and it's too hard to adjust it. So we're just going to do it down here, and I'm going to hold it, and she should push down in my palm. Okay, her foot pushed down. That works as well. And then I would end with my Roth, ask her if she needs any comforts, if she's experienced any pain, if anything came up over the time, if she needs anything. If she was in a hospital, I would make sure that the call light was in reach. The bed would be all the way down lowest position, bed rails up and locked. But we're not here, so she would just be sitting here, and I would ask her if she needed anything else. And then that would be it. And that's it for the neurological one.